Hi guys, my name is Karen, and this is a presentation I did with another intern at Palos Verdes Peninsula High School for the parents. And Peninsula High School is a high performing and high stakes school. With a lot of that comes high levels of stress and demands that many of our students are struggling to deal with on a daily basis. So, a lot of this may lead to many of the topics that we will discuss today. So, just to go over our agenda, we will be addressing mental health and its stigma. We will also go over some mindfulness activities and techniques that you can use with your kids at home. And then we will also be discussing bullying as well as anxiety and how it looks like in our student. We will also be addressing depression and then also share some on-campus resources as well. So, regarding mental health and stigma, it occurs in 1 out of every 5 young persons. So, that's pretty common if you think about it. And in order to eliminate the stigma associated with mental illness, one of the many things that we can do is talk openly about mental health just to eliminate that stigma. And then another thing that we can do is just to educate ourselves, continually learn about mental health. We should we should also be conscious of the language that we use regarding mental health. And then we should also be encouraging equality between physical and mental health since they're both kind of related. Show compassion for those who do have mental illnesses. Choose empowerment over shame, letting them know that they, at the end of the day, they are still in control of their lives, and then be very, very honest about treatment and about the options that they have, such as counseling, therapy, and medication. So, in regards to mindfulness, mindfulness is really great. One of the benefits of mindfulness are not just anecdotal, it really is a growing body of scientific research, and it really does show positive effects on mental health and well being. Additionally, practicing mindfulness has been shown to improve attention. It's been shown to reduce stress as well as increase one's ability to regulate their emotions and also to feel compassion and empathy, which is something that our kids do need to learn. Also, mindfulness is widely considered an effective psychotherapy treatment for adults, so not just only for students, but for adults as well. This can particularly help with students who have aggression, students with ADHD, and then also students who deal with anxiety, like many of our students do at Peninsula High School. And then recent medical research suggests that meditation may have proven neurological benefits, and it can help support mental health recovery from anxiety and depression. Overall, mindfulness is a key component in building resiliency when facing life stressors. So in regards to mindfulness meditation, mindfulness may rival antidepressants in easing the symptoms of depression, as according to research. And then it can also give practitioners greater cognitive flexibility and kind of help them to become less reactive. So therefore, that kind of decreases the emotional reactivity. It's also correlated directly with cognitive flexibility and attentional functioning. It's shown to enhance self insight, morality, intuition, and fear modulation as well, which leads to an improvement of overall well being that really our adolescents should be learning how to build these skills right now at this age. And so, I wanted to share with everybody some resources. These are some mindfulness apps that you can download for free on through the App Store. This first one right here is called the Calm app, and it's very similar to this one right here, the Headspace app, but basically it's an app that you can download on your phone that can guide you easily through breathing practices. It has soothing music to kind of help you focus, relax, and even sleep stories. It can kind of guide you through a sleep meditation if you have trouble sleeping, which a lot of our students actually do. It's free and it's easily accessible through the phone. You can access it anytime during the day if you really need it. Another thing that incorporates mindfulness is yoga. So, yoga includes breathing techniques. So, there are many resources that kids can access yoga on campus. We do have a yoga instructor on campus, and it is offered as a PE class. So, just even taking some of the techniques and doing it before school to start your mornings can help students prepare for school, just to kind of start off their way in a very positive way, or even at the end of the day or before bed. And then that last resource right there is a book called The Mindful Teen. This is a fun guide that includes tips and techniques, and it can include how to deal with stress from test taking, dealing with parents, even navigating through drama with peers, teaches you how to be aware of the present moment. And that's what mindfulness is. Um, it teaches you how to be mindfulness even when you're doing simple things such as taking a walk. Um, and that's it for the resources. And then in regards to bullying, here are some statistics. 28% of US students in grades 6 to 12 have experienced bullying. So that's a very high amount. And then 20% of US students in grades 9 to 12 experience bullying. These victims of face-to-face bullying often experience depression, anxiety, school failure, and school avoidance. And then victims of cyberbullying suffer equal, if not greater, psychological harm, because cyberbullying can occur 24 hours a day. It doesn't have to be during school time. It can be at home. So just to be mindful of that. And then some tips for parents to prevent cyberbullying. Just be conscious and aware and monitoring of your teen's social media sites. So be aware of their applications that they've downloaded. You can also view their browsing history if you have concerns that cyberbullying may be occurring. You can also review or reset your child's phone's location and privacy settings. You can also follow or friend your teenager on social media sites like Facebook or Instagram, or maybe have another trusted adult to do so. And then also stay up to date on the latest apps. So the social media platforms and digital slang used by children and teens. And then also know your child's usernames and passwords for email and social media. And then also remember to establish rules about appropriate digital behavior, content, and apps. Just having that open talk with them about social media. And then in regards to bullying, some of the research indicates that persistent bullying can lead to or worsen feelings of isolation, rejection, exclusion, and despair, which can also lead to depression and anxiety, which can contribute to suicidal behavior. And in very extreme occasions, cyberbullying can lead to youth suicide and external violence. Although the vast majority of young people who are bullied do not become suicidal, it's just something to think about. And then in regards to anxiety, anxiety affects 25% of children between the ages of 13 and 18, which is very high. And when it's left untreated, it can lead to a higher risk of performing poorly in school. They'll miss out on important social experiences, and then engage in substance abuse, such as drugs and alcohol. Some of the symptoms of anxiety disorder includes restlessness, feeling keyed up or on edge, easily fatigued, difficulties concentrating, irritability, muscle tension, and abnormal sleep patterns. So here are some things that you guys can do at home to help manage your child's anxiety. So just validating and paying attention to their feelings, letting them know to stay calm when your child feels anxious about a situation or event, just kind of talking them down, what's the worst thing that could happen in this situation. And then also just recognize and praise small accomplishments. So, something as simple as completing homework at home, letting them know like you worked really hard on this is great. And then don't punish for mistakes or lack of progress. Just know that your adolescents are trying really hard and school is difficult. And then also being flexible, but try to maintain a normal routine for them. Kids need structure, but if things fall out of place, it's okay to let that happen. And then also modifying expectations during stressful periods. So when they have a big exam or finals coming up, just letting them, if they want extra time on the computer, let them have it as a reward. And then plan for transitions. So, for example, allow extra time in the morning if getting school is difficult for your student. And then in regards to anxiety disorders are treatable, and the vast majority of people with an anxiety disorder can be helped with professional care. So some of the treatment options include therapy, medication, stress relaxation techniques, just like the ones that we were talking about. So I think the question is here is when do we know how to get our kids professional help? So I think it becomes alarming when it begins to affect their physical health. So when you start seeing, weight gain or weight loss, that's when it becomes an issue. And then when their relationships with their peers or family change. So they stop kind of, if they're nervous about going out, hanging out with their friends, for example. And then when you notice that they're using drugs and alcohol to self-medicate themselves. So just kind of being mindful of the alcohol placement in your house, because kids, they know where it is and they'll know where to find it. And then, if anxiety is causing your child to miss out on very important life events. So just school dances, community events, things like that. And then as far as depression is defined as a mood disorder that causes a persistent feeling of sadness and loss of interest in the things that they used to enjoy doing. It can affect how one person feels, thinks, and behaves, and it can lead to a variety of emotional and physical problems as well. One may have trouble doing normal day-to-day activities and may feel as if life isn't worth living. So some statistics: 1 in 5 teens have had a history of depression at some time. And additionally, twice as many girls have been diagnosed as compared to boys. Some signs of depression: so feeling persistently sad or blue, unhappiness, negativity, irritability, anger, rage, if they're talking about suicide or saying that they're better off dead, having a marked deterioration in school or home functioning, or reporting persistent physical complaints and making many visits to the school nurse, for example, dropping grades, failing to engage in what they used to think were pleasurable activities or interactions with friends, abusing substances, changes in eating or sleeping patterns, preoccupation with death. So if they're constantly talking about it, and self destructive behavior. Treatment of depression may include counseling, family therapy can help, group therapy, behavior programs, medications, and inpatient treatments. And all types of treatments have risks and benefits. The best strategy here is to educate yourself about the choices you can make, and then to also talk to your teen about it, letting them know that you're on their side and that you're supporting them. Just having that open talk with them. Untreated depression confers a major risk of suicide, so it is useful to consider that no treatment also carries risk. Overall, exercise and social support are also necessary elements of any good treatment plan to address depression. These interventions may fail to address more serious symptoms, but remain important throughout the course of the treatment. Both talk therapy and medications have been shown to be useful in a variety of many studies. And then here are some on-campus resources for your children to access. We have the student support specialist based in room 11. She's available, and her office is open every day for students to come in whenever they're feeling stressed out. They're able to come in and talk to her, as well as the counselors in the counseling offices, and the school psychologists can be resources as well. So that is it for my presentation. Thank you guys for listening.